Welcome everybody to Advanced Practice Week, day 2 of our conference here from Health Education England. And it's been an incredible week so far. So much work, so much showcasing of the incredible work that advanced practitioners across the country and across all 4 countries are undertaking in the UK and indeed across the world. So fantastic to be back with you again today. Really delighted. Monday was a brilliant day. The amount of the amount of feedback on the work that we've been doing is fantastic. Loads of learning and a huge amount of extra thinking and work to be done. So thank you so much for participating so actively on Monday. By lunchtime, we were trending on Twitter and did for several hours. So keep the work going on Twitter, please, everybody. There is an incredible community on Twitter of love, support, challenge, innovation, thinking, and sharing of best practice and great practice. So please, if you don't follow on Twitter, do have a look, do go and see. In this modern world of connected living, it's a really important way of keeping in touch. And I think what warmed my heart at about 11:30 on Monday evening, an ACP somewhere in the country flagged that they were struggling and having quite a tough time, needed some help. And within about 3.5 minutes, they had several people just wrapped around them, offering them some help in the moment around trying to achieve something, which, clearly not the purpose of Twitter, still a beautiful, beautiful way that we are able to connect with people. So I just flagged to you, there's a wealth of knowledge out there in different ways that we really start to capitalise upon. So thank you for sharing. There's a tweet by Gwyn Grout, and those of you who know Gwyn, she's done the work around the elder work, and she's done the work for us around mental health, which depicted the eggs that we talked about on Monday, the scrambled eggs not being our required position, but creating beautiful fried eggs in that frying pan, all of us recognising our egg yolk, which is the USP of me, Beverley, the physiotherapist, but my egg white where I can share and work together, learn new skills to meet my population's requirements of me. So some beautiful, beautiful moments that, again, just bring us together as a community and help us to share. We also have a group of advanced practice educators called AAPE UK, great group. And again, please get involved with them. They are a multi-professional group of people passionate about advanced practice education. And actually we work with them very, very closely as critical friends and really trying to think through and devise how we create innovative training programs, developments that meet the needs of our population. So please get involved. Follow them on Twitter, follow them on LinkedIn, work with them, get involved in their committees. Incredible group of people for whom we are absolutely indebted for their support and their help. So I also promised you a party bag. So on Monday, into your inboxes, we will get to you 3 things. I promised you ESR guidance, and again, a beautiful comment by somebody who said they'd never thought they'd ever be excited about the words ESR guidance. But again, colleagues, I have the gift of ESR for you. So that will pop into your inboxes early next week, alongside the COVID report of the work that we did during the end of that first phase of the pandemic to really understand how it had been for you, what had been the experience of you working in COVID, how your skills had been used. Really interesting piece of thinking. And also there's a beautiful animation that the team have worked on to start to think through how we message the language of advanced practice. It's a really complicated thing to land because it means something slightly different to everybody. And as you know, our narrative is one of being totally inclusive. Our work is working across all the professions. We work from nursing and midwifery, allied health, science, pharmacy, psychology, healthcare science. We're working with professions who are not statutorily regulated to understand what this means for them in this space. And we're now working with dental and with other colleagues to understand what is the opportunity for people advancing their practice. And you'll see very clearly our change in language here has been one of advancing our practice to try and be more inclusive and to really understand that spectrum that we talked about on Monday of advanced practice, which is absolutely, we're working very, very closely with medical colleagues in MDTs, in acute care, driving incredibly brilliant care for patients across 24 hours a day. And then we have the other spectrum, advanced practice, where, again, me as my old world, Beverley, the physiotherapist, highly, highly, highly specialist in non-invasive ventilation, respiratory failure. There was no credential for me. There was nothing that made me think, well, actually, I could be one of those. But I was absolutely an advanced level practitioner with a very bespoke scope of practice. And actually, I am working at the same level as colleagues in different roles. What I'm doing is I'm just expressing it very, very differently through a far more bespoke level of practice. So an ACP like me in the future will be an accredited ACP. I won't have a credential because there won't be a credential to meet me, but I will have a bespoke and agreed scope of practice, which is equally as recognisable, equally as valued, and equally as transferable as my colleagues who do carry the big ticket high risk credentials. So I really want people to take away from this conference an absolute understanding that our passion is the level of practice, pinning down it to be safe for us all, but being really clear for all of us that actually it's our level of practice that demarcates us, not whether we have a credential or not whether we are a certain kind of advanced practitioner, not if we're an ACP or an advanced nurse practitioner. We're all working at advanced practice level. And actually, I might be called a clinical specialist, whatever, nurse, dietitian, whatever I might be, I might have that title, but I might be working at an advanced level of practice. That's okay. Therefore, I'm an advanced level practitioner. So we need to start thinking about just really how we think about our language and how we really start to help people to understand the value and the absolute thinking behind this agenda, which is one of inclusivity, value of the level of practice, and actually making it mean something to everybody across that spectrum. Hugely important. So today we've got the feedback session from the workshops that you all participated in. Brilliant. I'm going to be doing that with Professor Joy Conway, who's an incredible asset in our team, who leads all of our research work with and for us, which is an absolute joy to have Joy with us today. And we've got the poster presentation, the big reveal. So just before we go into the regional teams at 11 o'clock, Joy will announce to you the winner of the poster competition, and the winner of the prize. We're really excited by that. Double the number of people coming forwards with posters, as you know, and every year the quality gets better. So thank you, Joy, and your team for doing that for us. We then have the regional conversations, and I have to say that I am beyond excited by the regions. The regions will become the most important part of what we do. Our regional teams, for me, are everything. Our regional teams are having the regional conversations with you. They're driving the ability of making sure that advanced level practice absolutely meets the needs of the systems that we are serving, the populations that we are serving, working with employers, working with universities to help us work both at a regional level and for the smaller areas like learning disabilities at a national level. So I'm delighted, and we'll be welcoming new members of our team today. We've got faculty leads coming in, most incredible people. We'll be introducing most of them to you, but some people are still working through, as we all know only too well, the HR processes where we're not yet able to, but as soon as we can, we will absolutely applaud from the rooftops our faculty leads, our supervision leads, our project teams wrapped around them, and the absolute intention to work with you regionally to drive this agenda to the best benefits of population. So hugely excited. It's the incredible outcome of a lot of people's hard work. And in one of the communications from this morning, we really are standing on the shoulders of giants, and I'm so proud of the work that's gone before. For years and years and years of hard work from people that we are now privileged to build upon. And I do really believe, looking at the incredible people that we are working with across the country, that we have the next generation of giants with us, and we are building those next generation of giants now. So thank you. Heartfelt thanks to everybody for what you're doing in the regions with the national team and all of us working together to summate our value. It's an incredible, incredible example of teamwork. We've then got sessions back into the credentials again, and I'm so sorry that many of you had problems getting through the links on Monday. We've discussed that with the team, and the team have put out some very good comms this morning where you should have every link that you need to get through. So we listened and we've got that cracked, I hope, for you today. So thank you for your patience. I hope things feel more easy to navigate this morning. And then the credential sessions will take us through a suite of the credentials on our website. As I said on Monday, there is a list of all the credentials that you may or may not need for the future that give you an idea of what's in progress, what's happening. So you can then start to understand, again, a little bit more about that credential piece. And don't forget, not everybody needs a credential. We're pinning down the big ticket items that are high risk, or the areas that are needing significant transformation, like learning disabilities, to really drive change. It is not about the fact that everybody has to have one. This is about pinning down areas that need a little bit more support, because you may be on an on-call rota at night time. Therefore, there needs to be a standard of your training. It's trying to be very pragmatic and very how the work is done. And then we move into a question and answer panel, which will have people from the Centre for Advancing Practice on that panel, so you can ask people directly any questions that you have about what we have talked about. So without further ado, I'm going to move on to the next session. I'm going to introduce Professor Joy Conway from Brunel University, who I think is having to join us by having to join us by phone today. I've got somebody phoning me very, very ferociously on my phone at the moment, but let's not worry about that. I hope it's not Joy. Joy, are you with us?
I am, yes, hi.
Marvellous, marvellous. The IT works. It's almost too exciting, Joy. Welcome, Joy.
Thank you.
Could we have the next slide, please? So we're moving into now the workshop feedback. Again, if I could have the next slide, please, that would be kind. So since Monday, since 11 o'clock on Monday morning, you've all been working feverishly to help get involved with the conversations, work through the things that we are thinking about at the moment, helping to guide us in some of the thinking. And thank you for everybody who's taken their time. There's been a lot of frenzied activity, which has been really good to see. Next slide, please. Again, just gives you an idea of the breakdown of who's been where. Surprisingly, not an awful lot of consultant activity, but we'll pick that up and make sure that conversation can be finished and make sure we get the right representation there. But again, this is an Advancing Practice conference, and what we will be doing next year is trying to work through the ability to run a consultant conference to really spend time deep into the issues facing our consultant workforce and really start to move that work on a pace, which is incredibly exciting. Next slide, please. So that shows you that most of the people who are participating were clearly registered clinicians, is how they chose to illustrate themselves, and again a good show of educators as part of that. But again, it helps us contextualise the results that we find when we know that 84% of people responding were registering themselves as clinicians in practice. Next slide, please. Professional groupings. This again, as you'll see, we've now seen several demonstrations of the professional groupings that take part. 62% nurses, by far our greatest number of people involved in advanced practice are clearly nurses, biggest profession, and have had a very established history in advanced practice. So great to see good representation there, but also nice to see good representation across other professions and beginning to see the other professions emerge. And I think, nice to see the pharmacists there. Healthcare science, we're working very clearly with healthcare science to understand how this translates into their world, and the same with psychology. So next slide, please. Lovely to see a district nurse in there as well too. Types of organisations, again, mainly acute trusts, which is, again, helps us contextualise some of the information, particularly when we're looking at the feedback on core curriculum, because again, there was quite an acute phase to some of that work, but again, it helps us understand where we are. But again, amazing to see half the world is in somewhere other than an acute trust, because had we done this 2 years ago, I don't know we would have seen quite such a beautiful picture appeared for us there on our pie chart. Next slide, please. And this is an incredible one. This is a beautiful little wheel here of smatterings across the country, and fabulous, incredibly fabulous to see this breadth of distribution across the country, because for us it's really clear that we have had some areas who have been very, very active in the space and some who are not. And so again, had we shown you a pie chart like this 2 years ago, I do not believe it would have looked like this. And I feel so proud of the regions for the work that they have done to drive this engagement, and so excited now knowing the people who are coming into post in their spaces, what we can do next to really drive that inclusivity of the agenda. So brilliant work, everybody. Thank you. Next slide, please. Where's my next slide? And you'll see we spread across the country quite beautifully, in a lovely array across the country, with a few people from outside and around, which again is always good to mix up the debate. And obviously, clearly, many people are interested in what we're up to. So lovely to see more of a reach. Next slide, please. Right, then I'm going to hand over to Joy now, please. So Joy, if you'd be kind enough to pick up the slides and the feedback. Thank you.
Yeah, thanks very much. So we had 7 workshops in total, and thank you so much for everybody who took part. We had almost 700 people taking part, which was fantastic. So this co-production of these themes is so important to us. So the first workshop was supervision and advanced clinical practice, and we had some great emerging themes. So supervision capacity is perceived to be limited. This was a topic that became, we had quite a few votes actually, and something we definitely need to discuss further. And alongside that, there's a desire for protected time, and there's a noticeable variance between sectors, between like acute and chronic sectors, etc. The importance of peer support had lots of votes. So this is perceived as a very important part of supervision, and one that clearly needs to be built into supervisory practice. So peer support is coming across as very strongly as a positive. There is this desire for competency frameworks, and there were comments about it being tailored for specific professions, specific groups of supervisees, and also for supervisors themselves. This is, as Bev said, we are working on the sort of big ticket competency frameworks, but certainly as we drive further into supervision and advanced clinical practice, we'll be looking at this, and perhaps that will be part of future work. The HE supervision guide that was recently published, which was the workplace supervision for advanced clinical practice, was seen as very helpful by most of you. Especially it's seen as useful for employers because it gives a structure, a focus as to how to actually manage supervision in practice. So next slide, please. So the next workshop we had was about continuing professional development. And we had some great discussions, great emerging themes for this session as well. The discussion focused, not surprisingly considering it's 2020, on innovation and training. So this year has been particularly strange, and so a lot of us have had to adapt to using online webinars. We've used Zoom, we've used Teams. I seem to be on Teams and Zoom constantly all day, but CPD especially has actually delivered very successfully using online platforms. And this virtual pathway is seen as something that everybody wants to take forward into the future because it enables people access to CPD wherever they are in the country, wherever they are, time and place. The importance of peer support was also highlighted in this workshop. So again, it's that feeling of being a community, of asking your fellow peers for support, and also for direction in terms of which CPD to take next, which areas to take next. So again, peer support is coming up as a big push. There's a desire for a joined-up approach for CPD across the centre and the leadership bodies and the regulators. There were comments about things like CPD requirements being slightly different for different regulators, for perhaps the Royal Colleges versus perhaps the new centre. So certainly we're going to have to keep an eye on that and make sure that CPD does have that joined-up approach. And we had loads of great different examples shared about practice and learning groups. And the ECHO project was mentioned, and there were some lovely discussions about great examples of CPD. Next slide, please. The next workshop was on developing multi-professional credentials. And this was an interesting one. So the discussion, the standards were felt that it was felt that they must reflect an agreed definition of advanced practice. And this, I think, again, as Bev was talking about, this is something that is very much central to all of our work. It's an agreed definition of advanced practice. And so the multi-professional credentials will emerge as a result of that definition of the core. The credentials will need to be tailored to key areas of practice. They will need to be robust. They will need to take agreement. And also there was a discussion about transferability of credentials, which is going to be, which is going to be a real positive for the future. There is support for a public directory where individuals' credentials could be viewed, but this is going to require quite a bit more thought and discussion and planning. What was great was one of the ideas that came up, which had a lot of votes, was that there was a need to co-design credentials with patient groups, and this is essential. So it is very important that our patients, their carers, the patient families understand what we do and help us to co-design credentials that fits what they need and that is clear in terms of being understandable to those outside of our particular area. And that follows on really for the next point, which is that we do need to help people to understand our roles, provide assurance and build that identity. And also, as Bev was saying earlier, there is a need to clarify that credentials are not a prerequisite for all advanced practitioners. So the research workshop was actually my workshop, and I really enjoyed it. Some great debates going on. Barriers and enablers, I think there was no surprise that there's a desire for more dedicated time for research. This came up repeatedly, that there isn't identifiable time set aside for research within job descriptions, etc. And there is a call for greater systems and leaders and a more collaborative approach, and also more visionary focus. So we're going to be working on that as we go into the next year. There were some lovely examples of positive impact of research seen by those taking part in the workshops, and that included seeing examples of improved care and improved cost savings. So some really nice positive examples. For the research priorities, we asked for research priorities to be identified to try to help us to form our new research strategy, which we'll be working on over the next year. And there was a debate about a need to focus on areas that are previously underrepresented. So particularly learning disabilities, virtual care, pathway redesign and evaluation, access to referral pathways, and diagnostic tools nationally. So we'll be looking at all of those. There is need for more funding for research for this level of clinical practice, and again, that's something we are very aware of and will be taking forward and looking at as we go forward into the next year for our strategy. We're going to be looking at how we access more funding for ACPs and how we signpost ACPs to funding streams. Dedicated time again has come up. Practical support is also welcome, so support with designing and writing research, database of ongoing research, clarity of processes, etc. So that's all good. Next slide, please. Oh, we're out of sequence, I think. Next slide, please. Sorry. The Centre for Advancing Practice, the emerging themes for the Centre for Advancing Practice is that the idea of a public directory was supported through the workshop discussion, and it highlighted issues which would need to be clarified, including things like the information to be shared and alignment with regulatory bodies and work for different pathways. It is possible for the Centre to have a role in promoting and explaining advanced clinical practice. So the need to promote and explain advanced clinical practice has come up repeatedly in the different workshops, and that's something all of us need to be working on. There's a desire for focus to reduce duplication. So this is in relation to providing evidence. So if we need to provide evidence for the centre, then it would be great if that doesn't need to be done in a different way, to say submitting evidence for the regulatory body, and that certainly will be looked at. The expected modules of the portfolios that need to be shared and understood. So we want to make sure that it covers a broad range of needs, including leadership and the non-academic skills. And there's a desire for flexibility over personal elements of the portfolio, which is fair enough, really. Next slide, please. So the next workshop was on creating a core advanced clinical practice curriculum. And the emerging themes for this one was that there is a desire for a curriculum to cover things like assessments and investigations and diagnosis and formulation. And also looking very much at person-centred collaborative working. There is a need, and this was great to see, it was stated there's a need to pay attention to the holistic care of people, and that is absolutely true. So by this, what that person was meaning, we raised this idea, was that we shouldn't look simply at a system like the respiratory system, but pay attention to the whole person, the holistic care. So we don't want to drive ourselves too far down into silos, but be aware of the holistic needs of the patient. There's a debate about balance between developing that core curriculum, which supports that sort of generalist advanced practitioner, but also that recognition that some roles are very specialist. So again, it's that example that Bev gave at the start of the highly specialist respiratory therapy versus a generous AP. We can all exist within this sphere, and we just need to make sure we don't pin ourselves down too hard to either being, a generalist, and therefore that means you can't be a specialist. That's not what this is about. So creating a core ACP curriculum needs to be something that is flexible. Next slide, please. The multi-professional consultant framework. So this is the consultant framework. And the emerging themes that came from the consultant framework group was that participants, they were calling for competencies to be based across the 5 consultant pillars. So there is work to be done in terms of looking at competencies of those 5 pillars. And there's also a good discussion about the importance of having strategic and system-wide capabilities at consultant level. So that's the so at consultant level, you are expected to be in strategic view to operate at a strategic level and at system-wide level. So there was a discussion about that this was important, and we need to try to define it and support that aspect of consultant practice. Next slide, please. So the next steps, all of this work will be fed into all of the different work streams. So the leaders of those workshops will be given the full transcripts of the work of the ideas and voting. That will be fed into work for the next year, and this will help to drive our work for the next year. So thank you all so much for taking part in this. It is essential that all of our work is co-produced, and we can't do this without your input. So thank you so much for all the efforts that you put into these workshops. We're going to be looking at things like, we're going to look at, for instance, the research strategy. We're going to be looking at credential development in the next year, and this is all going to be hugely valuable to us. As Bev said at the beginning, we now need to develop the advanced practice to consultant transition, and also looking at going through to consultant level. But also at the other end, we need to start looking at the position of the enhanced level practice and pulling that through into advanced practice. So we need to look at each stage. They're all separate identities of their own. Where people want to transition between those stages, we just need to work out that pathway. So there's lots of work coming up and all very exciting. But thank you so much for all of your input. It was hugely valuable. Next slide, please. So, drum roll, please. We had, as you know, a fantastic poster submission. We had 77 posters accepted and displayed. We chose 10 best, and from that 10 you were asked to vote for your best poster for this conference. The quality was exceptionally high. Thank you again so much. The winner of this best poster will get a Amazon gift voucher in the mail, and the winner is, next slide please, Heather Rimmer. Heather is a surgical nurse practitioner from Worcestershire Royal Hospital, and she's also a MSc student at the University of Worcester, and her poster on a service evaluation of advanced clinical practitioners' experiences with emergency redeployment to intensive care during the COVID health crisis was voted by you as the winner. Heather's poster is superb, fantastic, timely, and beautifully designed, and really she was a clear winner from the start and actually led in the voting from start to finish. So a very clear and very well deserved winner. Congratulations, Heather. Next slide, please. Okay, so next up we have the regional sessions from 11 o'clock to 12 o'clock. You have direct links in your email to join for your regional sessions. Thank you so much. Please note the hashtags that we're using for Twitter, and if you could tweet away, that would be superb. So enjoy your regional sessions. Bev, any last comments?
Thank you ever so much, Joy. If I could just point out to colleagues, spelling mistake on the hashtag on this slide, where the first one, which says AD Prac Week 20, it should be ADV for a shortened advancing. So ADV Prac Week 20 would be what that first hashtag would say. So Joy, thank you. That was absolutely brilliant. And I think the key thing is, the only thing I want to sort of just touch on from the feedback is when you look at the core curriculum piece, remember 84% of the work was acute facing. So what we will be looking for a core curriculum that underpins every advanced practitioner will be absolutely things along the lines of population health prevention, the level of decision making, the level of risk taking, all the things that actually are underpinning all of our definition of advanced practice. But there will also be very clearly for colleagues in acute facing roles a core acute facing curriculum that enables people to absolutely do the core clinical skills that they require. But I think what we're learning with the work that we're doing around core curriculum, and Annabella, who is one of our colleagues and current chair of API, is leading that work for us with the support of Ollie Phipps and many colleagues, is that we do absolutely need to understand that we need to set the common core in a really clever place that enables us to absolutely understand what joins us all together and what doesn't, and both are fine. So I'm going to stop there. You have that absolute highlight of the conference now, which is you're off to your regions. So please sign off, go find your regions, have a wonderful time, engage, come back for the credentials. Thank you, everybody. Brilliant work. Bye-bye.